Okay, so we're going to talk about vertebrae today, and we're going to show you the atlas, the axis, and the cervical vertebrae and what they look like first. So if you look at this vertebrae, this is going to be your atlas, this is going to be your axis, and this is going to be just a typical cervical vertebrae. So if you look right here, on the atlas and then the axis, if you think C1, atlas, C2, axis, and they're in alphabetical order from the top to the bottom. So when you look at this one, you're going to see on all cervical vertebrae, even the atlas and axis, you're going to see a transverse foramen, which is this hole right here, and this hole right here, and then over here, it's right here, and on the other side, and then over here, a typical cervical vertebrae is going to have the transverse foramen here, and also over on the other side. So we're going to start with your list and go down through the parts. We just went over transverse foramen, which are the holes on the side. Then if you look, the next one down is going to be the dens, which is right here, which is on the axis. It's also called the odontoid process. Then you're going to have transverse process, which are going to be these little arms that stick out on the side, which is right here and also right here. Can't really see this one, but it's over here on the side. And then over here you're going to have transverse process as well. And then the next thing that you're going to have is you're going to have a spinous process, which is like a nose sticking out. So you have spinous process here and a little spinous process here. The other structures that you're going to have is you have not a small hole, but a large hole in the middle of these. This is where your spinal cord is going to go. And that is going to be your spinal or vertebral foramen right there. Then if you look right here, you're going to have a body on the vertebrae, which is the top larger portion. And then the other structures that you're going to have is you're going to have superior and inferior articulating surfaces. So here you have a superior articulating surface, and if you flip it upside down, you're going to have inferior articulating surfaces.